They'll say, sorry, I'm getting recorded. Um, so, lay people or people not going through infertility will say, well, how can infertility be as bad as cancer or HIV positive status? And the fact is, and I know anyone who's heard me before, I pretty much say the same thing, that infertility impacts every area of your life. It affects your relationship because, as I said, I have never seen men and women in a heterosexual relationship respond in the same way or at the same time. It can have an impact on your sex life because, both of you might start to associate sex with failure. A lot of times, if you're trying to get pregnant on your own, one or both of you will say, well, it only makes sense to have sex mid-cycle because why bother trying? And it takes a lot of the spontaneity and fun out of your sex life when you keep on having sex and you just aren't getting pregnant. It affects your relationship with your family because, you know, in all probability, your mom probably didn't go through infertility. And so she may not truly understand what you guys are going through. Probably you have siblings that are getting pregnant, and that can be extremely painful. Same thing with friends. You might have friends getting pregnant. When people get pregnant and they have kids, that's all they tend to talk about. And so I have so many patients of mine that, when their sister or brother or, sister-in-law or brother-in-law get pregnant, they can't be with them. They can't be with someone who's pregnant. They can't tolerate hearing their parents talk about how excited they are to become grandparents. And so they tend to pull back from the family, and they may not want to go home for Christmas because they don't want to see their nieces and nephews, opening Christmas presents. They may not want to go to religious services because they don't want to hear sermons about babies and children and those things. And the same thing with your friends. It's really hard if you're struggling with infertility to have your friends talking about labor and delivery and, first communion and having babies and all that goes with that. It can impact your job because, infertility clinics can't time procedures to what your work life is like. And so, if you're going through a treatment cycle, you need to be at the clinic first thing in the morning. And, no one seems to care if you're a teacher and you have to be in the classroom at 7:30. Same thing, if your IUI is scheduled at 2 o'clock in the afternoon, the clinic can't take into account that you have a client presentation at 2. So it can have a huge impact on your job. And there are a lot of jobs that are just massive reminders of what you're going through. I mean, I've had patients who are OBGYNs or nurse midwives or labor and delivery room nurses or pediatricians. And, it's really hard when you're going through infertility and your day-to-day life, your job is a constant reminder of what you don't have. It can cause a lot of stress on financial security. Most states in this country do not mandate infertility coverage. There are a lot more companies now that are offering infertility benefits, but there are a lot of people who are still paying out of pocket for their treatment. And I learned in grad school that the top 3 things couples fight about are money, sex, and kids. And that pretty much encompasses infertility. It impacts your relationship with God because people may either wonder, why is God punishing you with infertility? Or wonder, why isn't God answering my prayers? And for both men and women, it can impact your body image because a lot of people associate fertility with sexuality and that, a womanly female person should be fertile and, a studly man should be able to knock up his partner. And so you have this disease, and infertility is a disease. It's been termed by the World Health Organization that infertility is a disease. It affects every aspect of your life. As I said, your relationship, your sex life, your relationship with family and friends, your job, your financial security, your relationship with God, and your body image. And there aren't a whole lot of diseases that have that kind of comprehensive impact on your life. Next slide, please. So, things to think about if you are a couple going through infertility is the person who has a diagnosis, if you guys have a diagnosis. I mean, male, female diagnoses are about the same. And so there are a few cases of unexplained. There are a few cases where it's both of you. But in the majority of cases, it's either a male factor or a female factor. And the research has shown that how a member of the couple copes with their infertility is strongly related to who is carrying the diagnosis. So if the woman has the infertility diagnosis, she's probably going to express and experience a lot more emotional pain than if it was a male factor diagnosis. And we know that in men, if a male factor has been diagnosed, they express a lot more anxiety and depression than men who don't carry a diagnosis. So if you're in a couple, be aware that whoever has the diagnosis of infertility is probably having a very, very different emotional reaction than the one who does not have a diagnosis. And, men do express more stoicism. When I get the guys alone, they talk about how they're feeling a lot of pain, but they want to sort of hold the couple together. But we still know that of couples in treatment, the majority of men report clinical levels of anxiety, and about a third of them report clinical levels of depression. So even if the male partner of a couple isn't talking as much, perhaps, about the emotional impact of infertility, that doesn't mean they're not feeling it, especially if there's a male factor diagnosis. Next slide, please. So the things that you should think about if you're a member of a couple who are going through infertility. For most of the couples I've seen, this is often the first crisis they encounter together. And, you date, happy, happy, you get married, happy, happy, you throw away the birth control, happy, happy, you don't get pregnant. And it may be the first thing that, the really big crisis that you encounter together. And there's assumption that if you two love each other, that you're going to handle your first crisis or any crisis in exactly the same way. And that's not really true. As I said from the beginning, you just don't tend to see both members of the couple feeling the same way and at the same time. And it doesn't mean your relationship is faulty or that you're going to have issues in the future. It just means that men and women respond to infertility differently. And who has the diagnosis, as I said, really matters. It also matters who's undergoing treatment. And, for whatever reason, the treatment for male factor infertility tends to be make the woman super fertile. So if you have a couple where the woman is reproductively healthy and there's a significant male factor, she will be undergoing an IVF cycle so that they can do what's called ICSI, where they can inject a sperm into each egg. And this can be tough for women. I've had a lot of female patients who are healthy just say it just doesn't feel fair that her partner has the fertility issue, but she's the one that has to undergo treatment. Things also to ponder is who spends more time researching infertility. There's a study that came out years ago that showed that the average woman going through infertility spent about 4 hours a day online. I have not seen any data in terms of the male partner, but my guess is in general, women are probably spending more time researching infertility. I have not seen data on same-sex couples, so I don't know how that is. But in heterosexual couples in general, the woman will spend more time researching infertility. And then she may resent the fact, especially if there's a male factor, that she's doing all this research time, and that her partner may not be doing anything at all other than, following doctor's orders. It also does matter who has close friends or especially siblings who are pregnant or have babies. And again, I think the most painful situation is for a woman going through infertility to have her younger sister get pregnant and produce the first grandchild. Although, I've had lots of patients who could not handle their partner's siblings having babies. So, some people are just extraordinarily sensitive to pregnancy, but if it's your friends or family, it can be much harder. As I said before, the top 3 things that couples fight about are money, sex, and kids. And, in most couples, there's one person who tends to worry more about money. In my relationship with my husband, I'm the one that worries about money. And so, because even if you have coverage, there tend to be co-pays and deductibles. The person who tends to worry about money more may have a lot more concerns about the cost of infertility treatment. And, finally, and this is not definitively a male-female thing, but some people are just more comfortable talking about their feelings. Again, we think that women are so emotional and are so willing to talk about their feelings. I tell you, when you get some of these male partners away from their wife or partner, they have feelings and they have painful feelings, and they just, they may not have grown up expressing their feelings, or they may not want to burden their partner with how sad or anxious they're feeling. But whoever's more comfortable will probably talk about their feelings more. It doesn't mean that they are in more pain. Next slide, please. So let's talk about, how can you cope if you're, a couple who are going through infertility and some of these things sort of ring a bell for you. I think the top issue I've seen in couples is that you make the assumption that the way you're coping is the right way to cope, and the way your partner is coping is the wrong way to cope. And that's not fair, because you are coping in the way that is right for you. And we have to take a leap of faith and say that your partner is coping in the right way for them. And so if you feel better when you talk more about your infertility and your partner tends to be pretty quiet, don't try to push your partner to talk about it more, because that, talking about it may help you, but it may not help your partner. So just respect the fact that you're doing what's right for you, and your partner may very well be doing the right way for them. Also, do not assume that your feelings are appropriate and theirs are not. And again, if you're in a heterosexual relationship, women may feel, as I said, they want to talk about it more. They may be emotional. They may express more anxiety and depression. And, a lot of men tend to be very problem focused. And so women tend to be more emotion focused. And so, if you're the female in a couple, may feel sad and anxious and angry and just all stirred up. And you get annoyed with your partner because they're very focused on what can you do to treat the problem. And let's follow the doctor's orders. Let's do this exactly. And that works for them, and yours works for you. And that's the way it's going to have to be. Also, do not assume that infertility has the same meaning to each of you. Your partner may have more ambivalence about having a family than you do, or you may have more ambivalence than your partner does. And it doesn't go straight down male-female lines. I mean, I've had lots of couples where the woman in the relationship had some ambivalence about having a baby, but her husband would pretty much do anything for them to have a baby. But don't assume that it has the same meaning to each of you. And again, I've had a lot of patients who are like the oldest girls in large families. And they're like, I'm not so sure I want to do this again. So just be aware of that. Do not assume you feel the same urgency. And, this is very age related. You do tend to see a feeling of urgency with women. Age is a bigger hit on female infertility, although there is also a hit with age and male fertility. And so, yeah, we do see these much, much, much older men getting their partners pregnant. That does not necessarily mean that pregnancy is going to go to term, and it does not necessarily mean the baby will be healthy. So just because a sperm fertilizes an egg doesn't mean that is going to be a healthy outcome. And so there should be some urgency as one gets older. Physiologically, yeah, it's certainly more urgency for women, but men can't wait forever also to have a baby. And, finally, this issue of disclosure, I published a paper, I don't know, about 10 years ago that showed that 57% of women in an infertile couple had not even told their mom. I think that number has probably gone down substantially because we're now seeing more and more and more celebrities who are talking about their infertility. But, my feeling has always been whoever carries the diagnosis should pretty much have a bigger vote in terms of disclosure. So if there is a female factor and the woman does not want people to know, I think her partner needs to respect her. And if it's a male factor and he does not want people to know, I think she needs to respect him. But each of you needs to give your partner some leniency, because they can't talk to just their infertility, especially if you're carrying the diagnosis. They might need to talk to a family member or a friend. They just can't keep everything bottled inside, and you may not be the best sounding board. But don't assume you both feel the same way about disclosure. Next slide, please. So here's a tip. This is what I started doing with my mind body groups many, many, many years ago. Because a common complaint amongst couples is that one of you wants to talk about it all the time and the other one never seems to want to talk about it, here's what we call paired listening. So you basically want to schedule time each day to actually talk to and hear each other. So let's just say it's after dinner from 7 to 7:20. That is your talking time. TV off, phones away. You each get between 5 and 10 minutes to talk about while the other person just listens. They cannot interrupt you. They cannot make faces. They cannot grunt. They cannot cross their arms and look ticked off. They have to just listen to you. And then they get the same amount of time and you have to just listen, which means you can't talk or grunt or do anything like that. And then the two of you just talk about it for a few minutes and then no more infertility talk until that time tomorrow. And what this means is the person who really wants to talk about it knows that they get heard. And the other person feels that that's not all you ever talk about. Okay. It really is a very effective way, excuse me, to enhance communication, but not feel like it's taking over your lives completely. Next slide, please. So here's some insights again that I've gathered over the years. Please be aware that no matter how much your partner loves you and how much you love your partner, they cannot read your mind and they cannot meet all of your needs. You can be the most amazing partner in the entire world. And I can tell you this right now, you cannot meet all the needs of your partner, especially as you go through a crisis like infertility. So each person needs to think about goal number one is you need to think about what your needs are. Like we run around going, oh my God, I'm so stressed. No one's meeting my needs. I'm just feeling anxious, tired. Okay, just stop and think. What do you need? I mean, pretty much during every session I have with patients, one of the first questions I ask them is, what do you need? And they just look at me like a deer in the headlights. Like, what are you talking about? What do you mean? What? And they stop and think, you know what? I've never really thought about what I need. And then of the needs you have, which ones is your partner capable of meeting? Again, your partner cannot meet all your needs. Which of your needs is your partner capable of meeting? And then think about who can meet your other needs. Do you have people, do you have family members, do you have friends, coworkers, clergy? And maybe most important, which of your needs can you meet yourself? That's not about being selfish. If one of your needs is to have a piece of really good chocolate every day, get yourself a really good piece of chocolate every day. Just think about it. Your partner can't meet all your needs. Think about what your needs your partner's capable of meeting. Think who else in your life is capable of meeting your needs and which ones you need to and want to meet yourself. Next slide, please. So I was actually talking to someone yesterday about a family member about what is the absolute most important thing in terms of the health of a couple. And that I think, and again, I don't think there's a hard and fast rule here, but this is my perception as a married person for 33 years and someone who's counseled a lot of couples with and without infertility. You need to be able to think of things from their perspective. So especially, for example, if you've had a fight, you need to take a step back and think, okay, what just went on here? And where are they coming from? You know how you're thinking and feeling, but how are they thinking and feeling? Do they have triggers you don't know about? Did something happen in their childhood? Has something happened in previous relationships? Is there a trigger they have that you don't know about? And do you have triggers you haven't told them? Like I can tell you, I've seen so many individuals or couples who've said, yeah, a big trigger for me is my partner raising their voice. Or a big trigger for me is when they walk away. Or a big trigger for me is the use of swear words or whatever else. If you know what your triggers are, you need to communicate them. And if you don't know what your partner's triggers are, you need to ask them. But there's a Native American expression that says you cannot really understand somebody until you've walked a mile in their moccasins. And I think, I don't mean to be politically incorrect at all, but I have to say, one of the most important things to be part of a healthy couple in terms of your relationship is understanding things from their perspective. What is the meaning of what's going on from their point of view? Next slide, please. So that's all I have to say. It's a lot of information I've just sort of dumped on you. And I really would like to spend the rest of the time answering your questions or getting your thoughts. And I think we have some questions in the box, Rachel.
Yes, we do. The first one is not so much a question, but I'm sure a lot of you are feeling this way, so I will read it out loud. Thank you. I feel so seen and heard. I just had a conversation last night with my family about why I don't want to be asked questions about babies anymore. I just want to acknowledge any of you that are feeling the same way. You know, this can be difficult, and you're not alone. There's a lot of you that are feeling similarly.
You
The
know,
first,
I have to say, as I said, when you can't read your partner's minds, you can't read your family's minds. And I remember long ago, I was, I think, engaged at the time, and a couple that we spent a lot of time with were very close to, have been married for about 4 or 5 years at that point. And I remember, and this is before I got into this field, this was a long time ago. And I remember a couple times saying, so, when are you guys going to make me an aunt? And, now I would realize I would never ask that question. And as it turned out, they weren't trying. They just wanted to buy a house before they tried. And they were young at the time. Um, I think unless you've been through infertility or you work in the field, you have no idea what you should or shouldn't do or say. And in fact, I proposed a webinar, which I hoping we'll do soon, is to do a webinar like this for your family and friends. And I'm not going to yell at them. I just want to explain infertility so that they understand more of what you're going through. And I have a whole list of do's and don'ts. Like, don't ask when you're going to have a baby. Don't give advice, things like that. But they're a bunch of do's too. But if you have family members who are pushing your buttons, you need to guide them on what's okay and what's not okay. I know that Resolve, the National Infertility Organization, a long time ago had a brochure called A Guide for Family and Friends. And I don't think obviously they print things anymore, but it probably wouldn't hurt to go to the Resolve website and see if I can't look at it right now, but to see if they still have that. But I intend to do a webinar, and I actually wrote an information sheet which I handed to marketing a couple weeks ago. And actually, Rachel could probably tell you better than I could what's going to happen to it.
yes, more news coming your way. So keep your eyes peeled for at your emails. But my first question here for you, Ali, is do you recommend acupuncture when doing IVF? If so, do you recommend it after the embryo transfer, or when do you recommend is the best time?
So this is a very general question. And before I joined Inception, I was actually the director of a very large complementary mind body center. And we actually had 6 acupuncturists there. So the fact that I employed 6 acupuncturists would suggest that I am a believer in acupuncture. The problem with acupuncture, because I'm also a scientist, is I can't tell you definitively that acupuncture will increase pregnancy rates of IVF. And I think that's what people want to know, because there probably have been as many studies that say, yes, acupuncture increases pregnancy rates, as there have been studies that have shown that acupuncture doesn't impact pregnancy rates. And I think the reason there is so much controversy is because no one's ever really done a good study, and including me. I did a randomized controlled trial many years ago, and we sort of took all comers and randomized them. So half got acupuncture, half didn't. And it turned out the people who volunteered to be in the study were actually pretty poor prognosis patients. And so I think the only way to definitively know is to recruit individuals or couples who have done PGT, and only individuals and couples who have one chromosomally normal blastocyst transferred. And then the only real data is doing acupuncture before and after embryo transfer. That said, I have done acupuncture personally many times. I have had 3 back surgeries and 1 shoulder surgery in the last 4 years. And I found acupuncture to be incredible in terms of pain relief. If you look at the data with the infertility population, as I said, it's up in the air whether or not they improve pregnancy rates. I personally think they do, but I can't tell you that as a scientist. What is clear is that people who do acupuncture feel far more relaxed. And if you ask them, would you want to do acupuncture pre and post embryo transfer for your next cycle? Almost all of them say yes. I mean, I have never in my life been as relaxed as I have been during acupuncture. But I can't tell you from a scientific, nerd-like expression that acupuncture increases pregnancy rates, because we don't have a definitive answer. I would say if you do not have a needle phobia and you can afford the acupuncture, give it a try, because the very least you will feel better psychologically, and you will also know you've done everything.
Thank you, Ali. Our next question is, I had my tubes tied almost 7 years ago when I had my son. Now we want to have another child. I'm 44 years old and we want to do IVF instead of a tubal reversal. Do you think that will be successful?
So that's a question you cannot ask a psychologist. You're going to have to ask an infertility doctor because, I mean, all I can tell you is that age, I think you said you were 44. Yes.
Yes.
Yes. Age is an issue in women with IVF. And I happened to look up some statistics last week. And in women over 42, the live birth rate in women over 42 who've done IVF is about 4 or 5%. Now, obviously, if you've had a child, that makes your prognosis play a little bit better. We know you can carry a pregnancy, but this is a question you have to ask your infertility doctor, not me. I'm sorry.
Next question we have is, are there any special or extra considerations for same-sex couples?
That's a really good question. And it's one I wish I could provide you with 22 different studies on. You know, I've personally obviously seen many same-sex couples, and ironically, tomorrow night, I'm giving a lecture for like Canada, physicians all over Canada on how to cancel people from the LGBTQ plus population who would like to build a family. There's certainly a lot of psychological considerations, and there are a lot of things that people from same-sex couples or individuals who are trying to have a baby have to think about in very different ways, and that people who care for them have to care for them in very different ways and be far more sensitive. I mean, in general, you know, because same-sex couples or people from the LGBTQ plus population who are trying to have a baby haven't been through infertility. And so it's a real steep learning curve to go from, oh, I think we would like to have a baby, to actually getting through infertility treatment. But it's not even fertility treatment. It's treatment to help you have a baby. But the pregnancy rates are much higher. So the research on IVF, for example, shows if you have same-sex lesbian couples, the pregnancy rates are far, far higher than they are for couples going through infertility. And the same thing for same-sex male couples. Because in all likelihood, there are no fertility issues. There's just, you know, what I told a patient of mine recently who was a lesbian, got them referring to herself as infertile. And I said, you're not infertile. Your diagnosis is lack of exposure to sperm. You don't have an infertility diagnosis. And so you do tend to see higher pregnancy rates. And, you know, I have to say, one of the things that impressed me the most about Inception, who they own all the Prelude clinics, is my first day last year was, I think, my first day on the job was May 31st, but the first time I was at headquarters in Houston was the first week of June of 2022. And again, I'm from Boston, very blue state. Texas is a little less so. But I stepped off the elevator and all I saw were rainbow flags everywhere. And, you know, I can tell you right now that the Prelude clinics are very responsive to the unique needs of people in same-sex or single-sex or single people from the LGBTQ plus community. I'm actually trying to create an app right now to better support people who are trying to have a baby. I don't know, did that answer your question? I just sort of went on and on and on. I'm sorry.
I'll keep a lookout if there's a follow-up to that, Ali. The next question we have is, do you have any recommendations for other resources that address this topic, such as articles or books? And I guess by this topic, they mean the communication.
Really good question. I mean, I wrote a book a long time ago, and it's called Conquering Infertility. And I think there's one chapter on communication. It probably says a lot of what I've just said to you. I'm sure a lot of my colleagues in this field have written books. I can't think of a book that specifically talks about couples communication during infertility, but I suspect there may be one. And I would just go on Amazon or Barnes and Noble or Resolve. And you can also go to asrm.org, and there's the mental health professional group, the MHPG, and they have a list of recommended books. So I would look there. I'm sorry, I'm not super current on what books come out all the time. And, you know, I hesitate to recommend a book that I haven't read myself.
Thank you, Ali. And we're putting a couple links in the chat as well, the ones that Ali is mentioning. So keep a lookout. I know Many of you mentioned the chat is disabled, but you should still be able to access those links. The next question we have is, how can I navigate overbearing family members who keep asking questions even after asking them to not talk about it without being rude?
Oh, that's when you need to be snarky. Um, I have to say, about 5 years ago, my colleague Liz Girl and I wrote an app called Ferticom. And for 3 years or so, Ferring Pharmaceuticals licensed it and had it all over it for anyone in Canada, the US, or South America could get it for free. And my favorite part of Ferticom was a thing called social solutions. And I have a really snarky sense of humor. So this was actually really great because we had, I think, 50 situations where people say something that's either not nice or not fair or mean. And we had 3 suggested responses. So there was a polite response, there was a educational response, and then there was what we called zingers. And so what I would say to you, if there is a comment that someone makes to you that really pushes your button, memorize a polite response, because there are probably some people who ask things and they're just oblivious and you just want to be polite and say, actually, my partner and I don't discuss our family building plans. That's just a polite response. An educational response would be, something to the effect of, infertility impacts 1 in 6 couples of childbearing age. We happen to be one of those couples, and we have a really good doctor and we're following their plans and we're optimistic about the future. And then a zinger could be, why are you asking me that question? Do I ask you how often you have sex? Or, that's one of my snarky responses. But literally think of the questions people ask you that bother you and memorize a polite response, an educational response, and a zinger. I have to say I had a little too much fun writing the zingers.
The next question for you is, do you recommend prenatal multivitamins? If yes, what success rates have you encountered with women before and after taking these?
Okay, so I'm a psychologist and I cannot be making any recommendations about what people should or should not be taking. All I can tell you is I can quote the research, because I'm also an associate professor part-time at Harvard Medical School. So I actually do spend half my time doing research, and I'm actually the director of the Inception Research Institute. What the research shows, there was one study of women who I believe were doing medicated IUI cycles. And the women who took a really high quality prenatal vitamin had significantly higher pregnancy rates than women who were taking, probably a not so high quality prenatal vitamin. And so I cannot tell you what you should or shouldn't do, but I would say everybody who's trying to get pregnant, all the data, ACOG, everybody says you should be taking a prenatal vitamin for at least 2 to 3 months before you get pregnant. And based on that research, I would try to seek out a high quality prenatal vitamin. That's about as diplomatic as I can be.
Thank you, Ali. The next question, we have a couple questions like this, so I'll try to make it a little bit more general, is if a couple people talking about how their communication with their partner is great, but where they're struggling with this communication with their clinic or their clinic staff members, and not feeling like there's any urgency, feeling like there's not a lot of warmth or empathy from their clinic. Do you have any recommendations of how they can navigate those conversations or communicate with their teams more effectively?
Well, all I can say is I really hope your complaints don't come from Prelude clinics, because I have spent a lot of time in the last 15 months going to clinics and talking about the aspects of infertility that are so hard for our patients, and the fact that for our patients, losing a month feels like a year, which I know all too well. I worked at an infertility clinic for 20 years before I joined Inception. Empathy is a skill that can be learned by everybody. I am personally doing a lot of trainings on empathic communication. I think the problem is that, everybody in healthcare these days feels a little overwhelmed. A lot of people left healthcare during and after COVID. And so a lot of places, clinics globally can be short staffed. And infertility treatment is really complicated. And so if you're going through a treatment cycle, you may have a zillion questions. I think one of the reasons they launched Prelude Connect, which is the app for Prelude patients, is to make communication a lot easier and a lot more direct. But just be aware that your nurse is probably doing her very best to keep up communication with as many patients as she can. I know a big complaint globally is that it's pretty rare to have if you call, to have the phone answered. Mainly because, I talked to a nurse a couple of years ago who said that she had spoken to 84 different patients that day. And so, it's a complex process. If you feel that somebody in the clinic has been rude to you or inappropriate with you, I think you could probably ask to speak to that person's manager. But I visited it already all but 4 of our clinics. And I have been really impressed by how dedicated people are to trying to deliver the best healthcare possible to all of our patients. And again, I'm hoping this is not a complaint from one of our clinics. And their misunderstandings happen. It's when you're trying to get pregnant and every minute counts, and someone says to you, okay, well, I know your doctor said you could start a cycle next week, but we don't have insurance approval for you yet. That can feel absolutely catastrophic. And I very much understand that. I've talked to a lot of patients who've been in that position. But, unless you want to pay out of pocket for the cycle, and most people don't want to pay out of pocket for a cycle, the clinic can't start your cycle. You can't do anything until you have insurance approval. And it may very well mean you have to wait a month. And your physician may not be aware of the backlog of the insurance company. All of us want you to feel as unstressed and comfortable as possible as you proceed, but no one can make the insurance companies move faster.
Thank you, Ali. Next question is, do you have any tips on how to keep stress levels down? I can't help but feel so much pressure from everyone around me to have a baby.
Well, excuse me, it's not their problem. It's, if your parents or his parents or your aunt, tough luck. This is an issue that you are facing. Presumably, if you're on this webinar, you're already seeking out professional help to try to get pregnant. I think, again, you got to come up with a polite response, an education response, and a zinger, because you're doing the best you can. You have to wait to be seen. You have to wait for the right point in your cycle to do the test, and you need to wait for the other appointment to be seen. You may need to wait for insurance approval. So these things can take time. And I know any delay is excruciating, but I think you have to be assertive, but not aggressive with people who are asking questions. That maybe if you're in a partnership, you need to decide together, maybe you handle your family's inquiries or intrusive comments, and your partner handles their family's inquiries or intrusive comments. I am hyper protective of individuals and couples going through infertility, and it really bothers me tremendously. If I could have a nickel for every one of my patients who heard someone say, just relax and you get pregnant, I would be, living on the beach with a little drink with an umbrella in it. There are a lot of misconceptions out there. There's a lot of media stupidity. There are a lot of celebrities who, so of course you can get pregnant with twins at 62. Just be self-protective and be protective of your partner, and just come up with, I don't know about you. I'm not someone who thinks on my feet. Like if someone says something that hurts my feelings, like 3 days later, it's like, that's what I should have said. I don't think on my feet. I'm always really impressed. Like the psychologist, Liz Girl, who created Ferticom with me, she's really good at just thinking on her feet. And I am so not. And that's why I'm saying is think of the questions that really bother you and memorize, what I call the snappy comeback lines.
Thank you, Ali. The next question we have is, how much of an effect does physical exercise and mental health have on improving fertility?
Oh, really, 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 really good question. So I can answer the first one because there's some pretty fresh data on the impact of exercise on fertility. And I think all the recent studies have shown the same thing, that moderate intensity, again, if a physician says it's okay for you to exercise, moderate intensity exercise seems to put you in the best place in terms of being fertile. So I'm saying, not great to be a couch potato, equally not great to be a marathon runner, but somewhere in the middle, taking a walk, going swimming, not crazy bicycling. Do not do things like hot yoga because we really don't want your body temperature to go up. But moderate exercise is the most likely way to put both of you in that sweet zone. And there was a second part of the question. Oh, stress.
Yes, physical exercise and stress impact fertility?
So I'm one of the people who've been researching the relationship between stress and infertility for like almost 40 years. I personally believe that stress decreases the efficacy of treatment. We have a fair amount of data to show that the more stressed one is before infertility, the longer it may take you to get pregnant. I know there are other people in the world who don't agree with me, but I've probably done the most research, certainly of anybody in the US. To definitively answer the question from a physiological point of view, we are now doing a large study with a company called Otto. They're based in Canada, and they make this little device. It looks like almost like an oval, and you wear it on a strap around your chest for like 3 minutes every morning. And so the study is ongoing. So if any of you are, in fact, Prelude patients, Prelude Clinic patients, and you're about to start your first IVF cycle, we would very much like you to be part of the study. I believe we have 120 people, I think, already enrolled. And we're actually about to do a preliminary data analysis. And so basically, you wear this little thing for 3 minutes every morning for the stim part of your cycle. So while you take the medications, and then again during the frozen embryo transfer. And basically, we are going to answer the question, does stress impact IVF outcome? Not stress like how you feeling today, but stress in terms of how, what's your heart doing in terms of stress? What's your brain doing in terms of stress? So it's a physiological model because emotional stress is very subjective. EEG, EKG, cardiac reactivity, those are not subjective. So ideally, we will have data to show by next summer whether or not stress per se impacts IVF outcome. Again, I believe it does. Not everyone believes that. And so if you are going through treatment, if you're trying to get pregnant, anything that you can do to lower your stress level, at the very least, will improve the quality of your life. And if you happen to get pregnant, that's a great side effect.
Thank you, Ali. Next question is, how can I support my partner's anxiety about their infertility diagnosis?
Oh, it's such a nice question. Thank you for asking that. I kind of ask your partner what they need. One exercise I used to have patients do when I was running groups is, and I actually got this idea from a patient, is write down 10 things your partner can do for you when you're having a really bad day, and then hand that list to your partner. And I can tell you, especially as a female person married to a man, I think, my partner lives in fear that I'm going to be in a bad mood and he won't know what to do to make me feel better. So just write down, for me, it would definitively give me a hug, let me watch something stupid on TV, get me ice cream, get takeout for dinner. But make a list of all the things that your partner can do that will help you feel better. Don't do this, by the way, when you're in a bad place. Do this when you're in a good place, and hand that list to your partner, and vice versa. And, obviously the lists are very different for each member of the couple, but it takes the guesswork away. Your partner, the partner can walk on the door and say, how are you? And you can say 7, I need 7, and they'll know exactly what to do. I like the fact that you asked that question. I think that was really nice because, again, you can't read their minds. Find out from them what they need from you, and it may change day to day.
Thank you, Ali. Next question is, how do I tell friends and family that I'm struggling with infertility and seeking out help without feeling ashamed?
You have a disease. Infertility is a disease. And so, every time someone talks about this, I'm like, okay, so if a friend of yours was diagnosed with diabetes or with multiple sclerosis or with anything, how would you react? This is a disease. One or both of you have been diagnosed with a disease. What do you need from whom? It's not something to be ashamed of. It's not. I was just reading an article. One of my coworkers sent it to me that I guess it was in Condé Nast Traveler. Someone wrote about, her antidote to a negative IVF cycle was travel. and how every time she did an embryo transfer that failed, she would go on a trip, which is very nice of you with those resources. But, she figured out what she needed, and she figured out a way to make it happen. And I think that, escape is not a bad thing, but think of what you need from the people in your life, and ask your partner to be protective of you. Again, if it's your partner's friend and family members who are causing the issue, they need to answer the questions. And again, answer questions up to your comfort level. You don't have to give them a lecture on, the medicine of infertility or infertility treatment, but answer up to your comfort level, and be self-protective. If you want to tell them to go jump off a cliff, tell them to go. I mean, that's why I think why I like all these zingers, because most people who want to know are asking you these questions because they love you and they want to support you and they don't know how to help you. But there are some people who are mean. And I have in my career seen 4 mothers-in-law who were so brutal to my patients that I told my patients to have them come in. And I spent 45 minutes telling them everything they were doing wrong to their daughter-in-law and everything they needed to do to be supportive. And it really changed their tune. And again, that's why I want to do a webinar for family and friends to really, I'm not going to read in the riot act. I just want to explain to them, how can you love and care for your family member who has the disease of infertility?
Thank you, Ali. Next one is, what is your advice for navigating communication when your partner and you are not on the same page about what the next step in your fertility journey should be, especially after multiple failed cycles?
This happens more often than not. It's very rare for 2 members of a couple to be on the same page at the same time. I mean, again, I think that's a good time to do this paired listening exercise, to give each of you a chance to talk and be heard. Being heard is really important. But I'd say if you're really stuck, if you go to ASRM, the American Society of Reproductive Medicine.org, and go to the mental health professional group, I believe there's 703 mental health professionals in the United States who have special training experience working with individuals and couples who are struggling with infertility. And sometimes having an impartial third person to hear both of you out and can help you get unstuck. So, for example, I think every therapist has to know what they're good at, what they're not good at. And I think I was really good at helping women make the transition from trying to get pregnant with their own eggs to moving on to donor egg. I don't feel I was very good at working with couples where one of them wanted to move on to adoption and the other one didn't. And there was a social worker in Boston who that was her expertise. Like her thing was helping people if the couple was stuck. And it was amazing. Everybody I referred to her, all my couples who were stuck in there, she unstuck them. And so, go look at there are people in every state, psychologists who belong to PsychPack can actually see people, I think, in 36 different states. There is someone out there who can help you.
Thank you, Ali. Another question here is, have you had couples divorce in the middle of IVF cycles? What resources do you recommend for a struggling couple?
Unfortunately, yes, I have had couples who have gotten divorced in the midst of treatment. I can't say it's been exactly in the middle of an IVF cycle, but the reason we have individuals and couples sign these incredibly complicated consent forms is because, if half of all marriages end in divorce, by the way, infertility, couples who go through infertility have lower divorce rates than couples who do not go through infertility. And I think there's something about if you can weather this crisis together, it makes you stronger. So I would be less worried about any of you getting divorced because you're sharing a crisis. It would be very sad to make a decision to get divorced in the middle of an IVF cycle. And I think at that point, you'd probably want either a really good couples counselor or separate counselors to talk to. But in general, the couples I have seen who ended up getting divorced during infertility or after infertility, there was a crack in the relationship before they started trying. It's pretty rare for infertility per se to cause a couple to divorce.
Thank you, Ali. What are some recommended methods or exercises for managing anxiety and stress that we can do individually or as a couple?
Well, okay, I'm going to plug my book again. which I shouldn't do because it's probably unethical. It's a conflict of interest. So I won't even, I wrote a book called Conquering Infertility. There's a lot in there for individuals and couples and exercises and stuff. That's actually what the app Ferticom did. It now is off the market. We licensed it to another company and they're creating a different product with a lot of the content. It's going to be a while before it's available. You know, for the second stage of the auto study, you know, if and when we can prove about the influence of stress, we're going to be doing a study looking at the impact of the best psychological interventions. I wish I could tell you there was a product out there that answers all your questions or can meet all your needs. And right now, I can't think of any. I'm uncomfortable with a lot of the marketing done with a lot of the apps out there right now in terms of the promises they make that are not research-based. And again, because I'm the nerd here, you can't make a claim about something unless there's data to back it up. You know, personally, my favorite app that I use for stress management is called Calm. I'm not endorsing Calm, it's just one that I personally like. It has nothing to do with infertility. I would probably suggest going to asrm.org and looking for the recommended resources and going to resolve.org and looking to recommended resources and follow those paths.
Thank you, Ali. Next question here we have is, do you have any strategies to deal with the delicate balance of being hopeful versus being realistic of the chances of each cycle?
You know, it's funny because I've said this so many times to patients is the really hard part about going through a treatment cycle is it's such a fine line that you need to psych yourself up enough to go through an IVF cycle, but not psych yourself up enough that if it doesn't work, you crash and burn. And it's very hard to do. And, you know, you wouldn't be starting a treatment cycle unless you had hope. Because if you knew the cycle wasn't going to work, you wouldn't be doing it. And if your physician knew it wasn't going to work, your physician would not be putting you through a treatment cycle. So clearly your physician is optimistic that it's a reasonable option is to do this cycle. In fact, I just wrote, I can't remember what I wrote this for. I just wrote something last week. I think it was for Rachel asked me to write something. I think the best way to go into a treatment cycle is to always have a plan B. And you don't have to stick to plan B, but no, okay, if this cycle doesn't work, this is what we want to do. We want to make an appointment to see our physician and try a different protocol. We want to sit down with our physician and actually talk seriously about donor egg or donor sperm. We want to, and this is something that people are afraid to talk about, you know, lifestyle habits can have a huge impact on fertility. And maybe it makes sense if a cycle doesn't work, that plan B is to sort of clean up your act. And I give a whole talk, I think I've done that for this webinar, on the impact of lifestyle behaviors on fertility. And, you know, smoking cigarettes is number one for both men and women. You know, literally smoking cigarettes adds 10 years to reproductive age. So a 25-year-old smoker is as fertile as a 35-year-old non-smoker. So if you're going to make one change in your life, stop smoking and stay away from secondhand smoke. Number two, people's weight, being underweight or obese can have a negative impact on fertility. Alcohol can have a negative impact on infertility. Caffeine is a little more up in the air, but there is some data that a lot of caffeine might increase the risk of miscarriage, et cetera, et cetera, et cetera. So, you know, again, plan B could be, you know, try a different treatment protocol. Plan B might be moving on to a more aggressive form of treatment. Plan B might be changing your lifestyle habits. Plan B might be seeing a counselor and learning skills to reduce your stress level. I can't tell you what you need, but these are all things that all of you could consider.
Thank you, Ali. I know we have a lot more questions from all of you, but to keep time, I'm going to maybe just randomly pick 2 or 3 that that we can answer for you all at this time. So let me just pick a random one.
Actually.
Yes, we have quite a few questions more, but I want to be mindful of everyone's time that's taken their evening to be with us. So
looking through the questions, I would just say that we are looking for ideas for all these webinars for 2024. As I said, what I really want to do is one for family and friends, but we're open for suggestions about all the other. So we really are looking for your ideas. And what would you like to hear?
Yes, and you can either put that in the Q&A box, in the chat, or there will be a poll at the end of the webinar as well, where you can give us your suggestion of any topics that you would find of interest to you. All right, let's maybe do 2 more, Ali, and then we can let everyone go. I have one for you here. I have a heavy past history of sexual trauma, and I'm struggling with keeping stress levels down as I'm worried I'm the reason my husband and I can't conceive. Do you have any advice on how to not blame myself?
About a third of all people trying to get pregnant have a history of sexual abuse, which is the same as the percentage in the normal population or the fertile population. So there's no indication that sexual trauma or sexual abuse increases the risk of infertility. It's about the same percentage. So I just think that statistic might help you. I sound like a broken record. I think if you've had a history of sexual trauma and you haven't received counseling from someone who is well versed and trained in supporting you, I think it might help to go through counseling. This is what I tell my patients. It's a tough load to bear. I'm sure a lot of you who are listening right now have the same history. And as I said, I've never seen any data to show it's more likely to cause infertility. But it probably, I mean, I've had so many patients who had a traumatic past who could not bear vaginal ultrasounds or pap smears or anything like that. There are a lot of you out there. And I think if you're struggling with some of the more challenging procedures, this is a conversation you should probably have with your physician and your nurse. This sounds terrible, but I've actually convinced some of the physicians I worked with to give patients like an Ativan or something to take before an embryo transfer or other procedures that make them feel very anxious. There are lots of relaxation techniques you can learn that will bring down your level of anxiety. And I would certainly recommend, I mean, I've been teaching relaxation techniques my whole career.
Thank you, Ali. And another one here is I've had multiple rounds of IVF, and with each round, my anxiety gets worse. Is this normal?
So this is what I tell my patients. I mean, if you think about this from a sort of psychological point of view, if you are doing something that causes you intense pain, doing it again probably is not going to get easier. And the more cycles one does that cause emotional pain, the harder it gets. As I said before, the fact that anybody is continuing to do treatment means that you continue to have hope. But if anyone's anxiety is getting worse, this is the time where you need to intervene and come up with ways to reduce your level of anxiety. And so ways to reduce one's level of anxiety include learning and practicing a relaxation technique on a daily basis, which brings down not only your level of anxiety in the moment, but after a couple of weeks, you have what's called a carryover effect, and your level just come down all the time, which means you sleep better, you're less irritable, you're less anxious. So number one is a relaxation technique. Number two is to learn some cognitive strategies, learning how to feel less stressed. And things like, as I said, my book, David Burns, a psychiatrist, wrote a really good book called The Feeling Good Handbook. And I have pretty much all my patients use that because it's a really, really good handbook on how to reduce anxiety. I think counseling. And then finally, join a support group. I mean, Resolve has support groups all over the country. I've run support groups, and I have to tell you, there's something really powerful about being with other people who feel exactly the same way you do. It makes you feel less alone. It makes you feel less abnormal. It makes you feel like all these thoughts and feelings you have that made you wonder if you were crazy, that everybody else in the room is feeling the same way. And so those are just some suggestions. And again, there is data to support the efficacy of all of these interventions.
Thank you, Ali. With that, we would like to say thank you to all of you that took your time to be with us today. We're sorry we couldn't get to all of your questions. Certainly join us for our upcoming sessions as well. Being here, you will get emails from us about our other upcoming sessions. You can also follow us on our social sites here, and you will be informed of any other upcoming sessions that we have with Ali and otherwise as well. And we wish you the very best on this journey. We are here for you. We are here to support you. You are not alone. Thank you so much again for being here with us. You will receive a recording of this session. If you would like to schedule a time to speak with a Prelude Network physician, you can always look us up at the Prelude Network. You will also receive a poll after the webinar ends, asking if you would like to schedule a consultation, asking if you found the session informative, and asking for any other future topics that you would like to learn about. So please give us your feedback so we can provide you with more information that is helpful to you all.
I want to thank all of you for joining. I wish you the very best of luck, and I hope you'll join us for our November webinar.
Thank you, Ali. Thank you, everyone. Have a good rest of your evening. Stay safe.